Ceiling lifting aid mechanisms, like other devices, are designed to minimize injuries to persons who need the device and staff when providing care to people who require mobility assistance. This course is designed to introduce the use of lift equipment and its components to staff who will be using it for the first time. Supervisors and new staff and senior staff can use this material to review and perfect their skills. After taking this course, you should be able to identify the parts and devices needed to operate and upkeep the lift mechanism, effectively operate and use lift and slings when assisting a person during transfers, inspection and maintenance of parts and devices. Ceiling lift mechanisms are used by healthcare provider staff to lift, reposition, and transfer a person whose mobility is impaired. The lifts are one of three components: the track system, trolley, and sling. The lift track is mounted to the ceiling with ceiling brackets. These tracks are specifically designed to best fit the needs and requirements the person and facilities may have. The trolley is mounted inside the track with wheels that allow the lift to move along the track. The lift attaches to the trolley by the eyelet of the trolley. The sling comes in various designs and shapes, each with a designated purpose. The slings will attach to the ceiling lift mechanism and will support the person while he or she is being lifted. Unfold the carry bar so that it is in a horizontal position. Attach the straps of the sling to the carry bar handles. Start with the legs and work your way up to the head and shoulder sling straps. The lift will automatically turn on once one of the up or down arrow buttons are pressed. You may also use the hand control by pressing the gray up or down button. The indicator light will turn green when the lift is on. If the indicator light turns orange or red, then the batteries of the lift are low and should be charged. Plug the charger wire to the lift by lining up the prongs. Make sure the lift is always plugged in when not in use. This is where the small metal ribbed pins located at the end of the airline attaches to. Both the airline and grommet have a ridge on their sides. Make sure this ridge lines up to ensure proper function of the handheld remote. The red down arrow button can be used in the event that both the hand remote buttons and lift buttons fail to lower the person. There will be a 2-second delay when the red emergency button is pressed. An alarm will sound during the emergency lowering. Any malfunctions should be documented, reported, and repaired immediately. The red on-off switch should always be kept in the on position, even when it is being charged. The lift will not operate if this button is in the off position. The lift will automatically shut off after 2 minutes if not being used. If the emergency red button in front of the lift will be used, then the on-off switch should be turned off. The lift should be serviced immediately before using it again. This is where the small metal ribbed pins located at the end of the airline attaches to. Both the airline and grommet have a ridge on one side. Make sure the ridge lines up to ensure proper function of the handheld remote. Another alternative to operate the lift is with the hand control by pressing either the gray button up or down. In the event that the mechanism buttons cease to work, connect the hand control and use it to operate the lift. If it does not work properly, contact your authorized dealers for repair. Most providers prefer not to have the remote connected to the mechanism to avoid getting it tangled with the straps and/or the person. The carabiner hook attaches to the eyelet of the lanyard extender or the trolley eyelet. Use this handle to carry and move the device. Carrying the lift in any other way may increase the risk of injuries. The battery should always be charging when not in use. Continuous charge will maximize the lift cycle of the battery. Make sure the lift and the charger are on a safe surface such as a table or countertop. The surface must be clean and dry. Line up the 3 metal prongs on the end of the charger with the 3 holes in the black lift DC connection. The indicator light on the charger will turn orange when it is charging the lift and will switch to solid green once it is fully charged. Do not use an electrical extension to extend the reach of the AC wall plug. Do not operate the lift while it is connected to the charger. Do not allow the batteries to become discharged below the low battery alarm, as this will decrease the battery life of the lift. Only use the charger that was supplied with the lift. Make sure you grab the wires closest to the end when disconnecting the wires. Do not pull on the wire when disconnecting, as this will damage the connector's connections and cause a malfunction. Under no circumstances should the track, lift, slings, and other systems be used by a person who has not been properly trained. The manufacturer's warranty is voided if persons unauthorized by Prism Medical perform work on the P440 lift system. Never expose the P440 directly to water. Warranty does not cover any misuse or abuse of the lift system. To maintain optimum function, the P440 should be inspected and maintained on a regular basis. Any accessories used with the P440, including tracks and slings, should be checked regularly to ensure that they are in good working condition. Check for any signs of damage prior to use. Report anything unusual or damaged immediately to your local authorized dealer or maintenance department. Do not, in any circumstances, exceed the maximum load of the lift. The weight capacity is printed on the label next to the red on-off switch. There is a risk of explosion if the lift is used in the presence of flammable anesthesics. This button can have 2 different colors, red or blue. Press the button to lift the person. Press the green down button to lower the person. Plug charger here when the lift is not in use. Green light lift is on and fully charged. Red light will light up when lifting. If it remains in red, it requires charging. Black metal collar on strap will activate the off switch when the lift is at top. Only the leg sling straps go in the inside bar handle. In the outside bar handle, the remaining sling straps are to be set up in this order: hip, back, shoulder, and head strap. Under no circumstance should the track, lift, and slings and other systems be used by a person who has not been properly trained. The manufacturer's warranty is voided if persons unauthorized by Prism Medical perform work on the PC2 lift system. Never expose the PC2 directly to water. Warranty does not cover any misuse or abuse of the lift system. To maintain optimum function, the PC2 should be inspected and maintained on a regular basis. Any accessories used with the PC2, including tracks and slings, should be checked regularly to ensure that they are in good working condition. Check for any signs of damage prior to use. Report anything unusual or damaged immediately to your local authorized dealer or maintenance department. Do not, in any circumstances, exceed the maximum load of the lift. The weight capacity of the PC2 is 300 pounds. There is a risk of explosion if the lift is used in the presence of flammable anesthesics. Lift strap loop, trolley, extender bar, C-hook? No. Always make sure the strap loop is correctly placed inside the C-hook. Yes. Remove the lift from the track and place it on a flat, stable surface. Make sure the lift is turned off. Plug the charger into an outlet. Plug the charger output cable into the silver jack on the front of the lift. Check to see that the charging light on the charger comes on. The yellow light on the charger will take several seconds to turn on. When it turns green, it is indicating that charging is completed. The PC2 ceiling lift is equipped with an emergency device which will give the user a one-time letdown in case of lift failure. Before using the emergency letdown, do the following. 1. Check the power switch to see if turned off accidentally. 2. Press the black circuit breaker button to reset, or if unit has a fuse, check and replace the fuse if needed. If neither of the above solves the problem, then follow the instructions on the printed emergency letdown located on the side of the lift. Then contact your provider for service. Do not try to use the lift until it has been repaired. Only suppliers who have been trained and authorized by Horscher should give detailed instruction as to the safe use of the Unilift. Only Horscher sling systems should be used with the Unilift. Improper use of the hoist or the use of unauthorized equipment or repairs could result in personal injury and invalidate any warranty or guarantee. Caution must always be exercised when operating the Unilift. The Unilift ceiling lift is attached permanently to the ceiling tracks and trolleys. The lift is already plugged in and continuously being charged. The operation of the lift is only through the handheld controller. The sling bar is what moves up and down, not the lift. The Unilift has a remote attached to the lift. With this remote, you control the lift up and down movement. Hand controls are safe for use in damp areas, but should not be immersed in water. Only the leg sling straps go on the inside bar handle hooks. The remaining sling straps go on the outside bar hooks in the following order: hip, back, shoulder, and head strap. Do not use the lift if you have used the emergency letdown controls. Contact your supplier to arrange for it to be repaired. All Unilift models are fitted with 3 controls to lower the lift spreader bar in an emergency: 2 electrical and 1 mechanical. Electrical emergency letdown. If the hand controls fail to work properly, press the black button on the bottom of the lift between the fuse and the remote power line to lower the person. Note, the unit will not charge while in the off position. Mechanical emergency letdown. If both the hand controls and the electrical emergency lowering device fail, the Unilift is fitted with a mechanical emergency letdown. Remove the end cap by using a 5mm Allen key. Use a small Phillips head screwdriver to remove the screws on the bottom of the lift that connects to the end caps to the metal casing. When the end caps are removed, insert a 6mm Allen key into the end of the motor and turn counterclockwise to lower. Should the lift fail to work, unscrew the fuse holder with a screwdriver or coin to see if it has blown. If it has been blown, replace it with the spare and call for service. Prior to each use, the portable lift, track, accessories, and slings must be inspected. Do not use the lift should any of the items fail the inspection. Contact your local authorized dealer for service immediately. Visually check for the following. The lift strap shows no signs of fraying or breaking along its entire length. The stitching on the lift strap shows no signs of fraying or breaking. The sling that will be used shows no signs of unusual wear or damage. The straps of the sling that connect to the carry bar hooks of the lift show no signs of fraying or breaking. If attached, the airline tube that connects the hand control to the lift is not kinked, twisted, knotted, cut, or damaged. All the functions on the hand control work correctly, for instance, up and down. The lift has no unusual sounds when it is moved up or down or along the track. Ensure that there are end stops installed at each end of the track. There are no cuts, dents, or sharp edges on the carry bar hooks that may damage straps of the sling. The carabiner hook or the strap loop shall be visually inspected before and after each lift for damages. Should any of these items fail the inspection, Do not use the lift. Contact your local authorized dealer for advice. Complete the visual inspection as noted during routine use. With no one in the sling nor attached to the lift, check the following. The lift moves freely along the entire length of the track. It is highly recommended that portable lifts undergo preventative maintenance either every 6 months or once a year. If the portable lift is used frequently, more than 1,000 lifts a year, or the portable lift is continuously being used to lift heavier than average clients, if this is the case, then the portable lift should be checked and go through maintenance by a lift technician every 6 months. Mesh, commonly used for bathing and toileting. Nylon polyester, all-purpose sling. Padded fabric. Padding area will be on the shoulders and leg area for added comfort. Para silk. This material makes the sling easy to slide on and off. Aerotex. Reduces the chances of a person slipping off the sling. Lamb's wool. Ideal for people with skin sensitivities. To ensure the safety of the individual and the caregiver, all slings must be the correct size and design for the person using it and the type of care we will be providing. The following guide will assist you in selecting the correct sling for the individual you care for. Please remember that a support and health-related device order is in place and that the proper documentation is readily available at all times. Slings are only to be used by the person who it is assigned to. Size and weight range guide approximately. Please note the following sling guide is a recommendation only. A full risk assessment must be done prior to any sling being selected. This will ensure safety for the patient and caregiver. Follow the manufacturer's sanitation and wash instructions. Remove metal or plastic reinforcements if required. The sling should be placed into a washer laundry bag. Scrub and disinfect areas that will be in contact with the patient's skin from blood or bodily fluids. Do not bleach. Do not iron. Air dry only. Do not machine dry. Attaching the loop strap to the lift. Place the straps of the slings over the lift hooks or swivel bar. Match the corresponding colors on each side of the sling for an even lift of the patient. Remember, the legs are attached to the lift in the inside middle hooks first. If the lift has 4 sets of hooks like in the PC2 and the swivel bar on the Unilift system, then the other strap loops go on the outside hooks of the lift from the hip to the head. If the lift only has 2 sets of hooks like the P440, then start with the legs and continue upwards to the head. Start connecting the sling strap loops to the lift in the following order: leg strap loops, hip strap loops, shoulder strap loops, head support strap loops. You may lay the person back to an angle by configuring the leg strap loops up closer to the lift and lowering the shoulder and the head strap loops further from the lift. Do not lean the person back much if the sling does not have a backrest or a headrest. You may sit the person upright by configuring the leg strap loops furthest from the lift and the shoulder/head strap loops closest to the lift. Remember, the person's arms should always be close to their body. Arms should not hang out of the slings. Straps can be reconfigured if the person has specific positioning restrictions. This should be documented and trained to all staff working with the individual. Approach the individual to the side so he knows you are there. Always talk to the individual and let them know you are there to assist them. Ask if they would be okay to be moved and what your intentions are. Having a professional relationship with the individual will improve their quality of life. Make sure you have a clear path to the transfer site. Align the wheelchair to the ceiling track and trolley and have it be perpendicular to the bed or chair you will be transferring the individual to. Remove the armrests and footrests from the wheelchair. Center the sling to the person's back and slightly lean them forward from the shoulders. Slide the sling by the person's back till the end of the sling is slightly under them. Remove the seatbelt. Slide the leg support under and around the person's thighs. Set the seat belt back so you can gather the rest of the equipment. When disconnecting the power cord, do so by pulling on the end of the wire connector. Never pull on the wire to disconnect the cord. Carefully lift the lift by the handle and set it on the bed or table near the person that will be lifted. Attach the carabiner or strap loop to the C-hook or D-hook of the track trolley or extension. Starting from the legs, attach the leg strap loop. It should go straight to the lift hook. Then attach the other strap loops in this order: hips, shoulders, and head. With the P440, all straps go on each side of the lift hooks, starting with the legs, hip, shoulders, and head. With the PC2 and Unilift ceiling lifts, the leg straps attach to the center hooks and the hips, shoulders, and head attached to the outer hooks. Lift the person once all straps are securely attached. It is best practice to put your hand on the back of the lift to avoid hitting the person's face with it. Once the lift is high enough, it will clear the person's face and end clear of the person's head. Take the left or right leg strap and cross them under the individual's thighs till the end of the sling straps are on the outside of the opposite thighs. Then attach the other strap loops in this order: hips, shoulders, and head. With the P440, all straps go on each side of the lift hooks, starting with the legs, hips, shoulders, and head. C2 and Unilift ceiling lifts, the leg straps attach to the center hooks and the hips, shoulders, and head attached to the outer hooks. Lift the person once all straps are securely attached. It is best practice to put your hand on the back of the lift to avoid hitting the person's face with it. Slide one leg strap through the end loop of the other leg strap as to form an X. With the P440, all straps go on each side of the lift hooks, starting with the legs, hip, shoulders, and head. With the PC2 and Unilift ceiling lifts, the leg straps attach to the center hooks and the hip, shoulder, and head attached to the outer hooks. Take off the seatbelt. Lift the person once all straps are securely attached. It is best practice to put your hand on the back of the lift to avoid hitting the person's face with it. Once the lift is high enough, it will clear the person's face and end clear of the person's head. Lift the person and slowly guide the person's body to the bed. Make sure the bed rails are up before performing the next steps. Unhook the strap loops starting with the head, shoulders, hips, and legs. Please make note, if the person is able to, put the arm closer to you, bent under the person's head, and cross the leg farthest from you over the other leg. Pull the person towards you by the shoulder and hip. Fold the sling under the person as close as you can. Bring the person back to her back and move to the other side of the bed. Please make note, if the person is able to, put the arm closer to you, bent under the person's head, and cross the leg farthest from you over the other leg. Pull the person towards you by the shoulder and hip. At this point, the sling should be easy to remove. Bring the person to her back and follow up with positioning guidelines. Fold the sling and set it perpendicular to the person's body. Please make note, if the person is able to, put the arm closer to you, bent under the person's head, and cross the leg farthest from you over the other leg. Pull the person towards you by the shoulder and hip. Gently tuck the sling under the person till the center of the sling is lined up to the person's spine. Return the person to her back. Move to the other side of the bed. Please make note, if the person is able to, put the arm closer to you, bent under the person's head, and cross the leg farthest from you over the other leg. Pull the person towards you by the shoulder and hip. Unroll the sling and open it so that the person is now laying centered to the sling. Slide the sling leg strap under and around the person's thigh. Bring the lift mechanism and center it to the person's navel. Choose a leg configuration that works best for the individual's comfort: cross, cradle, or straight up. Start with the legs and work your way up hips, shoulders, and head. Lift and bring the person to the wheelchair. Take off the sling straps starting from the head strap and work your way down to the legs. Slightly bend the person forward by the shoulders and pull the sling out. Engage the wheelchair seat belts and assemble the other components of the wheelchair.